Hi, and welcome to The Deepest Cut. Thank you for joining us. My name is Sahar Sadughi. I'm one of the cardiothoracic surgeons here at Mayo Clinic. It's a great pleasure to welcome Marci Newcome, Director of our NPPAs for cardiovascular surgery here at Mayo Clinic. Marci, thanks for joining us.
Thank you for having me.
I really wanted to take the opportunity to interview you just because you've had such success in both the clinical realm as well as the leadership realm here. And I wanted to hear a little bit about how you got to where you are.
I really took quite a long road to get here. I've been at Mayo for 25 years now, and throughout my career, I've been constantly moving forward. I started in the beginning being an EMT. From there, I went to a nursing assistant, 2-year, or LPN, 2-year RN, 4-year RN, on up to where I am now, which is a doctoral prepared nurse practitioner. And I think, it's been baby steps along the way, but that's what's worked well for me, and raising a family and being married and just my career path.
Sure. And did you, when you started, did you have this vision for yourself that you wanted to be, where you are, or did it sort of just evolve over time?
It really evolved over time. I think when I went to college, I didn't know what I wanted to do. I had probably 6 different majors along the way before I discovered nursing. And, through my career as a nurse at Mayo Clinic, doors have just opened and opportunities to continue to advance my education. And I've always wanted to expand myself a little bit further, push myself a little bit further, grow my education. And that's just kind of the passion that's pursued me to continue to move forward.
Okay. So just thinking about, cardiovascular surgery, very male-dominated field. You've got a pretty, important leadership position there as a female. Have you faced struggles through that process?
I have. I think I work with a great group of cardiac surgeons, but, there's a lot of imposter syndrome that goes through, and I certainly think I still to this day feel it. But I think once you develop relationships with people and get them to trust you, and things naturally evolve from there. And I think that's what's made me successful is I grew my way into this position. And so all of these surgeons have known me since they were training, and it's been many years. So I think that trust is there, and that's helped me further myself and my leadership within the department.
And through this process, has there been opportunities or a vision of yourself where doors have closed and you thought, well, am I not meant for this? Or how did you overcome some of those things?
Absolutely. I think when you reflect back on your career, you have a lot of different opportunities and a lot of different paths you can choose. And sometimes when doors don't open, it's because another great opportunity is coming down the road. And I think early on, you have to really look for those opportunities. They don't necessarily come looking for you, but you have to knock on those doors and ask for those opportunities to lead or be a part of something, or for a seat at the table for different things. And, truly when you're told no, or you don't get an opportunity, or a door doesn't open, sometimes that's the path you're meant to take. Had everything gone, all the opportunities I had came along, I'd have left cardiac surgery many years ago.
Oh, good thing you didn't do that. Yeah. So now, sort of where you are, how do you instill some of these values in some of your people that are in your team?
I think really pushing people to step outside just the clinical practice. Often as nurse practitioner and physician assistants, we're focused on that day-to-day patient and the care of the patient, but what more can they do professionally? Not only for themselves and for the NPPA profession, but also for cardiovascular surgery. Is it speaking at a national conference? Is it bringing an outcome poster to a quality conference? Is it teaching? Is it mentoring? Is it leading? But what else can they do to really help advance themselves?
Yeah. I've seen the practice, the NPP practice sort of evolve over my training here and now. And it's such an integral part of the practice. What do you think's next for this role?
I think a couple things coming down the pike is really bringing this practice, NPPA practice, onto the national stage. I think we've taken some steps in the right direction. We have an online CME. We're looking for an avenue to do an in-person CME. We've got a lot of people that are starting to speak nationally about our practice and the great things that we're doing within the practice. And then we're starting a fellowship for NPs and PAs in cardiac surgery and cardiothoracic transplants. So it'll be exciting to really get the opportunity to continue to train our colleagues and mentor them.
And another point I was just thinking about is you've also expanded to the operating room as well. So you sort of practice within the floor, practice within the ICU, practice in the operating room.
When I joined the practice as a NP back in 2013, I was the 33rd FTE within the practice. We now have 95 FTEs.
Wow.
My position didn't exist. Three of the supervisors under me didn't exist. We've grown exponentially.
Yeah.
And I think that's, been the constant thing within cardiac surgery, and especially the cardiothoracic transplant practice, is that growth. But it's given us a lot of opportunities to expand our practice and the role we have within the department. And that's been really satisfying as a leader to be able to bring roles in and really see those NPs and PAs practice at the top of their scope and, be fulfilled professionally.
Yeah. So what do you think is next for you?
So I think my goals for the next few years, we just launched the Office of NPPAs at Mayo Rochester. So really bringing the Mayo Rochester NPPA profession onto the national stage and really highlighting the good work that we do, as well as the cardiac surgery NPPA profession, really encouraging those underneath me to, expand, present, lead, teach. I think that's one thing in my leadership. I've always been kind of that servant leader for Mayo, but also that transformational leader. I find the most pleasure in leadership when people under me succeed. And I really see that the APP practice grow as a whole.
Now, I can imagine that there's been some challenges with all of those changes. What has kept you hungry and motivated?
I think my colleagues and the patients. I think that's what keeps me coming back. We've built a fantastic group of NPs and PAs within the department. We've certainly gone through our challenges over the years, from years that we had almost 40% turnover to we were down to 6% turnover last year. So it's been that growth, building this really great team, and now seeing them really expand professionally and up the practice. There's been so many new things that we've brought in. You had mentioned the operating room practice. We're continuing to expand that. We've expanded into the transplant clinic. We're doing more procedures in hospital with POCUS and arterial lines and things like that. So really great to see them take ownership and really push the bar on their own practices.
I can imagine also over the time with you being a leader, you've seen a change in like the diversity of the practitioners. Can you speak to that a little bit? And
Absolutely. I think, one of the things that we pride ourselves on is that we hire the right person. And that has nothing to do with the color of their skin or their sexual orientation or male, female, but it's about what can they bring to the team and the care that they can provide our patients. And I think really being able to interview people and bring out those characteristics has helped us build a tremendous team that has a lot of different views on things, which is great to bring that diversity and those different perspectives to the table when we're looking at challenges or how can we do things better for our patients.
And just to end, you mentioned you're a mom and you got a lot of this going on in leadership. So talk to me a little bit about how you try to balance all of that.
I think that's something I've struggled with my entire career. But I had a mentor say to me a while back, you just need to know when to say no. And I think I continue to get better at that throughout my career, but really making sure that at the end of the day, I pause, leave work behind, and then I have a 20-minute commute back home. And that's really my time to kind of go over my day start to finish, wrap up all those loose things, loose ends in my head, so that when I walk in that door, I'm there for my husband and my family.
Perfect.
And I'm able to leave work behind for the most part.
Yes. Yeah. It's always hard, especially in this practice.
Yes.
But wonderful. Well, it's just been so great to hear about how things have started and where they're going and all the transformations. And we thank you so much for all of your leadership in the division.
Well, thank you for having me. It's been a pleasure.
Thank you.